For 3 straight days, therapy dog Cooper kept escaping his assigned pediatric ward. Every morning, he'd trot into St. Mary's Hospital in his blue vest, full of tail wags for the sick children. But by noon, he'd vanish. Nurses would find him scratching at the door of room 417, where 78-year-old Mrs. Chen lay in a coma, her family already saying their goodbyes. The head nurse, Sarah, was losing patience. "He's supposed to help the kids, not bother terminal patients," she snapped, writing him up for the 3rd time. She even called the shelter, ready to send him back. But Cooper's handler, Mark, begged for one more day. On Friday morning, Cooper slipped his leash within minutes. He bolted straight to room 417, but this time, he didn't just sit quietly. He began pawing at Mrs. Chen's blanket, then her IV line, whining in a way that made the cardiac monitor beep faster. When Nurse Sarah stormed in to drag him out, Cooper did something he'd never been trained to do. He gently grabbed the IV tube in his mouth and tugged it toward her, his eyes pleading. Sarah's anger turned to confusion. She leaned closer and gasped. The clear fluid had a faint pinkish swirl and a strange sweet smell. She called the doctor. Mrs. Chen had developed a deadly catheter infection, sepsis setting in. The machines hadn't caught it yet, but Cooper had smelled the bacterial bloom hours before any human could. They started antibiotics immediately. 2 days later, Mrs. Chen opened her eyes for the first time in 3 weeks. Her first request? "Can I pet the dog who saved me?" Cooper now has his own ID badge that reads, Chief Medical Detection Officer. The dog they almost fired is now the hospital's most valued staff member. Because sometimes, the best medicine comes on 4 legs.